when you look at the treatments and what people are putting off in the wake of COVID-19, it's sort of your run-of-the-mill procedures, your annual physical, your dentist appointment. People say in larger numbers that that's what they're not seeking treatment for, more so than, say, mental health therapy or specialized treatments for fertility and other reasons. One thing that I'm just wondering about is, in the wake of this pandemic and with more people staying home, one thing that our Ipsos polling has shown is in recent weeks, more people have said that their mental health and their emotional well-being have worsened. So I look at that, I want to hone in on that number about people that are not seeking mental health treatment right now. For a couple reasons. Now, that number is not so big because some people just don't seek therapy to begin with. But as you have more of the population reporting that their mental health and their well-being are worsening, I wonder if we're going to start seeing a shift in people that are actually prioritizing seeking treatment for their mental health if they had done before, or more people perhaps seeking treatment on that for the first time.
It's been about maybe a month and a half where some of the more clear public guidance on staying at home, really making a distinction between essential and elective medical procedures has been pushed out to the public. And so it's just over the first month and a half, we're starting to see that people are starting to defer that elective, what they think is elective. And I think the real question is that blanket statement about defer elective procedures or elective care appropriate for everybody? So let me give you an example. If you're pregnant right now, it's really important to have antenatal care. And that community has been pretty proactive about making sure they're reaching out to their patients. But we already knew that in African American communities, mortality for mothers and their children was already higher. My heart goes out to folks that are already in the middle of a really challenging health situation, whether it's in cancer care, a chronic condition, or maybe waiting on a surgery that is core to their identity. And in all three of these cases, and potentially many others, time mattered already. Getting things done expediently matters. And so the delays that we're seeing and the health system that's really struggling to try to make sure that there aren't delays, but inevitably there will be, it's going to have real impacts on people's outcomes and their care during this process. I think the real question becomes, how are we redesigning the systems we have so that we can be more proactive, we can make sure we're reaching people where they are in their homes, for instance, and that we really know who we really need to make an extra effort to get out to, and not just wait for somebody to call. And so these are the tough situations that people are finding themselves in. And I think part of a lot of the work that lies ahead is how do we make sure that we are reaching folks either before they have an issue or as soon as they have an issue, or at least removing barriers when they do have an issue.